Treating narcolepsy, as we've mentioned, it's a holistic approach, as Alon mentioned, and you have to treat them psychosocially as well as pharmacologically. But many of these patients need a lot of support, don't they, Eveline? And what can the Narcolepsy Network do to help these patients?
Yes, so support is so important because in the doctor's office, where they go once every 3 months or so, they get 15 minutes to 30 minutes, but they really need help in so many other areas of life. So at Narcolepsy Network, we provide all kinds of services. We have an annual conference, which is a weekend-long conference where we have all kinds of speakers, ranging from the latest research to medications to even lawyers to help with driver's licenses and legal issues that people run into all the time, to school issues, special education plans, nutrition, lifestyle things. So a whole weekend filled with main sessions, but also breakout sessions, a lot of support sessions. We do one-day meetings. I know all of you have been to them. We also have support groups for people to come to. People really like to meet face-to-face. And then they discover that there's a lot of things that they all have. For example, one thing that wasn't mentioned yet, a lot of people with narcolepsy struggle with being disorganized. They lose everything. They can't find their keys. And so then they all hear like, oh, you have that too? I didn't know that was part of it. I thought it was just part of my personality. But then they find out they all have that. So they like to compare, and also they talk about medications, of course. We also have a relatively new program called Youth Ambassador Program. This is for young people between the ages of 15 and 22. And we train them. They have a short presentation, a little bit like what we do here, but very short version. And they go out to their communities, to schools, service clubs like Rotaries, churches, synagogues, sometimes just a family group. They go to the newspapers and they talk about narcolepsy, not necessarily their personal experience, but we prefer that it's someone with narcolepsy. So this is a growing program and it works really well with the young people talking about narcolepsy and what it's like.
Yeah, I find that when I see a patient with narcolepsy, in most cases, they don't know anyone else that's got narcolepsy. And of course, narcolepsy usually occurs as an isolated condition in a family. There are not other family members with it in most cases. And so the opportunity to be able to meet with other people at your conferences, I think, is an enormous help to these patients, just to see somebody else who's going through the same thing that they're going through is a great benefit to them. And for children too.
I would echo all of that. I think our clinic, we're very lucky to have a cognitive behavior therapist too, and this is very helpful for management of medications, requiring sort of the nap that, no surprise, kids don't like to break up their day and go to a school nurse to nap, but they kind of emphasize the importance of that and sleep hygiene. And I think just it gives a sense of agency over their symptoms, that they can control it to some degree, and that's very important. And be able to confidently talk about narcolepsy and their needs is, I think, also very important. So I find that, in addition to medications, an important tool.
If I may add to the conversation in that, oftentimes we realize we just don't have enough time to spend with these patients. Mm-hmm. And I realized over the last few years, I really needed to set enough time. And oftentimes I set my first appointments with anyone suspected of having narcolepsy as the last appointment of the day, because I realized this is a time in which you have to review symptoms, you have to corroborate and re-review diagnostic tests, you have to look at the patient's expectations, you have to then look at what medication would best fit them, and educate the patient about the medication. And that cannot be placed in a 1 hour appointment, or certainly not half an hour. So The message is to really spend as much time as a patient needs. Follow-up visits, especially with family members, spouses, are really critical. And we've also started to use video visits to just touch base with the patient after giving them a certain medication, to just make sure the patient is responding to it without waiting for the patient to contact us, say, with certain complaints that we did not expect. So I think that's a huge opportunity for everyone to just be ready and be attuned to those needs from this really unique patient population.
The Narcolepsy Network, I'll just mention, I was at the last meeting, and I think for younger people it gives them a sense of hope that, I mean, there's a physician that has narcolepsy that spoke. There's, lawyers that, I mean, there are people that are very high functioning. So I think that it gives a sense of they don't feel so helpless. That if they do want to achieve something, they still have that ability to. They have sort of, in some sort of proverbial hand behind the back sort of situation, but they can really achieve a lot. But the burden is very high. The disease burden is just so high for many of them. But they attend those meetings and get a sense of hope, which they did not have.
I think that's very important, and to keep the right balance. We don't want people to think, oh, well, you have narcolepsy, you get medications, and you can become a doctor, like one of our board members, a sleep doctor. You could be a high-functioning lawyer. There is a balance. There's still a lot of people struggling despite the medications, and it's not like everybody can become a sleep doctor or a lawyer, and so. But it's very important to give people hope, and so they can see we can do these things.